certainly agree with the importance of getting coverage for as many people in this country as possible. I think the problem with the ACA that I see is that while it was going for that very noble objective, it didn't deal with the issues you then brought up in terms of the expense. And the fact is, the conflicts of interest on the part of the pharmaceutical industry, on the part of the insurance industry, on the part of some specialists who abuse their practice, and quite a few other conflicts of interest are really not being dealt with and are damaging to so many people who are now not able to afford care.
I agree.
Well, there's the additional problem that Obamacare isn't something, it's different in every state.
That's correct.
And a lot of the critical questions have yet to be fought out, like what's effective care? It's supposed to only pay for effective care. Each state, as I understand it, is going to figure out what's effective care in their opinion. There are likely to be some big differences between Boston and Louisiana in that perception.
Well, we know already, because of the massive differences in the cost of care regionally,
Yes.
that this is going to be a problem. I mean, here in Los Angeles, we've got the second most expensive hospital in the United States of America. This is insane. Why do we tolerate it? Why do we pay for that?
Well, and there are like two hospitals 10 miles apart. One of them charges $150,000 for a hip replacement, and one of them charges $15,000. Now, how do you explain that?
I don't know. Ironically, the Leapfrog Group just rated hospitals in California. UCLA got an F for patient safety, and all of the Kaiser hospitals but one in the state got an A. Now, go figure. To me, by the way, it's obvious. The Kaiser Permanente has aligned the interests and motivations of the physicians directly with their patients. You keep patients well, you make more money at the end of the year. You don't make more money by doing unnecessary things to people.
What about your thoughts about how to empower patients more than they currently are in terms of the relationship with their healthcare providers?
Larry, I've been fighting that battle, as you know, for 35 years, and it's a tough one. But I tell people they have to take more responsibility for what happens to them. They have to take more responsibility for their health care, and they have to take more responsibility for their medical care. It's not enough to just walk in and say, I'm in your hands, do what you want with me. This is just craziness. But it's not easy. I mean, we're battling decades, centuries of habit pattern here. But I'm not going to give up.
What about advocacy in terms of patient advocacy? Because many of these issues relate to our congresspersons who are taking money from various proprietary interests and serving those interests, and who leave the patients hanging pretty loose.
Well, I'm pessimistic. It's come down to money and power in this country now. And I don't think that patient advocacy groups are ever going to be able to accumulate either the money or the power that the industry groups, the commercial interests in this country have assembled. We have watched the price of branded pharmaceutical drugs, old drugs, not new drugs, not innovative drugs, increase at 5 times the rate of inflation over the last 6-7 years. Nobody does anything about it. We could just go down the entire list. And I don't know how we stop this. The citizenry just, I don't know how to describe it. They're just passive. They don't care. They're also, we live in an age of sloganry. I mean, ironically, you find people acting against their best interests because they don't even understand the situation. So hand them a 2,800-page bill designed to fix things, and it's a prescription for disaster.